Hi, thank you for joining us today. My topic is on weight management. My name is Vijaya Surampudi. I'm currently an endocrinologist as well as a physician nutrition specialist. I focus on using nutrition and lifestyle modification as a preventative tool as well as creating a healthier life for you. My current interest actually is using food and nutrition and lifestyle changes to prevent as well as to create a healthy lifestyle. So, the big thing is that I want to address is that please ask questions. On Twitter using the hashtag UCLAMDChat or comment on Facebook. We love questions, so please send us in questions. So center stage. The New Yorker has a series of front page covers talking about this topic, about weight. The New Yorker does a beautiful job outlining this over the past couple decades, in fact. So currently, obesity is a concern because 70% of the US population is considered overweight. 1 out of 3 people are considered obese. So the next few slides are actually a series of graphs. These are prevalence data, meaning how many people reported that they were obese in the States. So this starts from 2011. So bear with me, I'm going to take you through some slides here. So focus on these orange areas for me. That represents that 30% of the people who were polled said that they were obese. And then the red is greater than 35%. So follow with me. So this is 2012. 2013, we start getting red states in Mississippi and West Virginia. Over 35% of their population is reporting that they're obese. Arkansas has joined in 2014. Now, if you look at this map at 2015, you can see over 50% of the country is struggling with obesity, where over 30% of their populations are considered obese. So let's look at it in a different way. So the top half of this graph represents people struggling with obesity. And obesity is defined with a BMI of greater than 30. So it's just a ratio. You can use an online calculator and figure out your weight and your height and figure out your BMI. And so with that, you can look at 1994, where you didn't have a lot of states reporting people who were obese. However, in 2014, you can see that there's been a shift in prevalence of obesity. Now, let's look at it in correlation to diabetes. Diabetes is one of the most common endocrine disorders that we're struggling with in the United States. So you look at 1994 and then look at 2014. The trends follow with obesity. And so some endocrinologists refer it to diabesity. They put the two together that they correlate. So we have an epidemic on hand. So the question is, what is changing? Why are things different? Why are we struggling with this? So this is a beautiful, I like old photography. So this is a beautiful picture from the New York Public Library. And it's a horse-drawn tractor. This picture was taken in the late 1800s, early 1900s. And a lot of our ancestors were on the farms. They were doing a lot of manual labor. Whatever they ate, they grew. So this is a picture from New York City, 1950s. Things were changing. The Industrial Revolution happened. People are moving away from the farms, and they're moving into the cities. Lifestyle's changing. Population is changing. There was a lot of immigration happening at this time. So the US was starting to face a very interesting problem. How do we feed all these mouths? How do we get all these calories? Where do we feed these people? So the next slide is a graph of the USDA data in the 1900s. Starting from 1900 all the way to 2000, the change in food supply that's available. So the y-axis is the calories per day, and the x-axis is the year. So here you can see in the early 1900s, it was under 3,500 calories per day available for consumption per person. But you can see that there was a shift somewhere in the 1960s, 1970s, and it started to increase. Now, the latest data that the USDA put out in 2014 and 2015 is that we have over 4,000 calories available per consumption per person per day. So what's also changing is the style of our work environment. So we are no longer using those horse-drawn tractors. We are now sitting at desks, we're sitting at computers, and we're not moving as much. So you can see in this, so this is the years, and 1960 to 2010, you can see that moderate intensity jobs have gone down, whereas light and sedentary have gone up. So we have more calories available to us, and we are moving around less. So our energy balance in our society is now altered. We now live in a nutrient excess society. So this is a big concern. So there are other reasons that people do gain weight. I'm not saying there are not. So endocrine conditions that are out there, thyroid problems, cortisol problems, those can cause weight gain. Other things that can cause weight gain are medications, for instance. So some of the diabetes meds actually cause weight gain. Some of the antidepressants cause weight gain. So there are other reasons that people put on weight. Genetic conditions are another reason that people put on weight. So let's look at it sort of, why is there a big concern? A lot of people will come in and it's, I don't feel anything, I feel fine. Why should I be worried about gaining weight? What is the problem? So this is sort of a graph sort of depiction of what is going on. So we have more food being taken in, we have less activity. So we have more calories, so we have to store it somewhere. So we store it as fat. And there's two ways that it gets stored. So diseases that are due to increased fat cell size, so the fat cells are actually getting bigger, actually have consequences in relation to diabetes, fatty liver, non-alcoholic fatty liver disease, cardiovascular disease, gallbladder disease, and certain cancers, particularly breast cancer, breast cancer, as well as prostate cancer. There are diseases due to increased fat mass. So osteoarthritis, so the sheer weight on your body puts more pressure on your hips, ankles, and knees. Sleep apnea, just sleeping at nighttime becomes more difficult because just the pressure on your chest while you're sleeping. So these are things that slowly over time, as we increase in weight, can affect the body. So people will come into the clinic and they'll be like, what can I do? I have 100 pounds to lose. This is too much. I can't deal with it. So it seems very daunting in the very beginning. But I always tell my patients that it's not, don't look at it as a big thing, it's actually a small thing. They've done numerous studies that saying that only losing 5 to 10% of your total body weight can actually have major health benefits, including lowering blood pressure, lowering blood sugar, and lowering your cholesterol. People have come off blood pressure medications after losing 10% of their weight. So for example, if a 200-pound person is trying to lose weight, if you lost 20 pounds, that actually will impact you health-wise and improve your health. So the next slide is actually my favorite. A lot of people struggle with arthritis and joint pains. A lot of knee pain, a lot of ankle pains. So what we've seen in the data is that if a young person loses 10 to 15 pounds and is able to keep it off, they dramatically reduce their risk of developing osteoarthritis later in life. The other thing is that for every pound that you have on your body is 4 pounds of load on your knee. So that means if you lose 10 pounds, that is 40 pounds of pressure or stress on your knees that you've taken off. So think about it this way. Have you ever seen those large water cooler bottles that are about 5 gallons? That weighs 40 pounds. That's 40 pounds off your knees. So it's just small amounts that can make a huge impact in your life. This came out recently. This study came out recently in the New England Journal of Medicine in 2016. And so what it's showing us is actually genetic risk and lifestyle. So let me show you a little bit on this graph. So what they did is they looked at genetic risk profiles. And so people who were low genetic risk, intermediate genetic risk, and high genetic risk. And when they did favorable lifestyle modifications, so this blue color represents favorable lifestyle modification. So that means they were high in fruits and vegetables, they ate a lot of protein, as well as exercising at least once or twice a week. And so they reduced, look at the red bar, this is an unfavorable lifestyle, blue bar is a favorable lifestyle, almost by 50%. meaning your life and living a healthy lifestyle can reduce your cardiovascular risk in the long run. And so this is something that recently came out, that you can help yourself. You can change your life and be a healthier you. So when you're focusing on your health, there's 4 aspects that I like to consider. It's nutrition, your mind. When I say your mind, I tell my patients all the time, it's not what you're eating, it's what's eating you. So stress reduction, exercise, sleep. Sleep is not given enough credit, and it's a whole topic on its own, so I'm not going to delve into it today. But I'm going to focus a little bit on nutrition. So, nutrition, not every calorie is the same. So this is the standard American diet, also known as SAD. So when we look at a plate typically on a standard American diet, everything is brown. And it's not the way it should be. It should be a very colorful plate, which we will get to. So let me go into some basic science, because I want you to understand why nutrition is so important. So these are mouse models. There's been several studies that are looking at mouse models and the microbiome. When I talk about the microbiome, I'm specifically referring to the gut microbiome. So all the bacteria lining from your mouth all the way down to your colon is what I'm referring to. And so these are mice that, on this side is a normal mouse who has no change in its bacteria, and its gut bacteria. This mouse with the red stop sign in there, that's a mouse that was treated with antibiotics, and they wiped out all the bacteria in the mouse. They fed them a standard American diet, which means high fat, high sugar, high salt, and high carbohydrate. The normal mouse gained a significant amount of weight. It became obese. The mouse that didn't have any bacteria in it barely gained any weight when fed the same diet. What that means is the bacteria in our gut play an influential role on how we use food in our body. So let's look at another set. So in the lower panel, so we're going to look at all these germ-free mice. So they were treated with antibiotics. They don't have any bacteria in their gut. So they were given what's called a fecal transplant. So that means they gave the feces of, I know it's not the most pleasant topic at lunchtime, I'm sorry. They gave the feces and transplanted it into from a normal mouse into the germ-free mouse. That mouse did not gain weight. They gave the obese mouse's fecal transplant to a germ-free mouse. That mouse became obese. So in the last one, they've done surgery, like bariatric surgery, to some mice, and then they transplanted the surgically weight loss induced mice's feces into the germ-free mouse, and they lost weight. So what is that telling us? How do we impact our microbiome? A lot of it is our environment. A lot of it is what we put in our mouth. People have done studies, especially here at UCLA at the Center of Human Nutrition, where they've done juicing studies and checked their microbiome, where their microbiome changed in a matter of 3 days. However, if you go back to your regular lifestyle, the microbiome goes back to what it previously was. So you can actually change your microbiome based on what you're eating. So how do you nourish your body? I usually ask my patients, why do you eat? And they give me things, oh, it makes me feel good. Oh, I want to, I'm happy, I'm sad, I'm stressed, that's why I eat. We forget that we used to live in periods of famine. That food was there to nourish our body, to give it energy. We need fat, we need carbohydrates, we need protein, we need all these things to nourish our body. This is my version of the ideal plate. Half the plate should be vegetables. A quarter of the plate should be protein. Some starches, healthy fats, and spices. I'm a big fan of spices. There's a lot of medicinal benefits with using spices in cooking. So I'm going to focus a little bit on carbohydrates. The reason is I'm an endocrinologist, so I like to talk about carbohydrates. So carbohydrates include potatoes, rice, beans, lentils, hummus, corn, peas, even fruit. A lot of people get surprised when I say that fruit is considered a carbohydrate. So this image looks a little bit daunting, but what I want you to take away from this particular slide is that when we eat carbohydrates, what happens in the body? So we eat a carbohydrate. I'm going to go really extreme and tell you that I ate a donut. I ate a donut. What happens to my donut? The goal of the body is to break it down into usable fuel. So that donut gets broken down into glucose and fructose. So those are simple sugars. They're the most common simple sugars that are available for usage in the body. So let's look at it. So sucrose is simple table sugar. The body breaks it down into glucose and fructose. Now, every cell in our body can use glucose for energy. However, what happens to fructose? The only cells that are able to handle fructose is the liver. So let's talk about fructose a little bit. In the early 1900s, the average American only consumed 15 grams of fructose. However, now it's changed. We consume 4 to 5 times that. So in the early 1900s, we were primarily only eating fruits and vegetables. There's very limited processed carbohydrates, very limited sodas. And so we're consuming almost 4 to 5 times that. So our liver is now trying to handle much more fructose in our body. So what happens if fructose starts to build up in our liver? So this is just a schematic of what we think the fructose is related to human diseases. But if we have increased fructose, that means cholesterol metabolism is altered. People can have an increase in cholesterol, particularly triglycerides. Glucose metabolism is altered and you can start to develop insulin resistance. People have started seeing associations with high fructose amount and fatty liver disease. So these are things to keep into consideration. So when talking about carbohydrates, the amount of carbohydrates one needs depends on one's age, gender, and activity level. One, we need to stop or reduce the amount of processed carbohydrates that we consume. Avoiding sodas, juices, pastries, anything with added sugar. Focus on vegetable, fruits, anything high fiber carbohydrates like lentils, beans, peas. These are better sources of carbohydrates. So I always get asked this question, well, if I stop eating carbs, won't I feel hungry? You might, but there's a way around this. So protein. Protein has a significant impact on satiety, meaning you will feel more full. There have been several studies, numerous studies, in fact, showing that people who have a protein-rich diet tend to do better with weight loss and weight maintenance. And so with the use of protein, you'll have increased satiety, increased thermogenesis, meaning you're burning more heat, meaning you're burning more calories. And it's better maintenance of lean body mass. So the muscle mass in your body is better maintained with more protein. So some people start asking me, are you supporting the Atkins diet? I'm not going as far as saying Atkins. What I'm saying is higher protein and lower carbs, everything in moderation. It's about re-ratioing your life. So currently, the mean recommendation is anywhere from 0.6 to 0.8 grams of protein per kilogram per day. So that means for the average healthy man and woman, it's about 50 to 70 grams of protein. So with that, some people have different considerations, particularly kidney disease, so do talk to your doctor about what your protein goals are. So muscle and weight loss. One thing that I do want to highlight is when people are losing a lot of weight, they don't just lose fat, they lose muscle. And so that's a big concern because muscle is the biggest contributor to your metabolism. And so as people lose weight, their metabolism slowly slows down because 1, they're a smaller person, 2, they're losing some muscle mass. So protein is a way to try to maintain your muscle mass. The other grouping of people that typically struggle with their weight is through the aging process. So as people age, they lose muscle and they increase their percent body fat. So their metabolisms also start to slow down. So it's a big concern. Some people, some endocrinologists, some people in nutrition do recommend that we should be targeting 1.6 grams per kilogram per day if you're actively trying to lose weight. But again, this all depends on medical history and medical conditions. So amount of protein one needs depends on one's medical conditions, age, gender, and activity level. Protein can help reduce hunger and help maintain lean body mass. So I want to lose weight, what can I do? So here's my thing, is no one size fits all. This has to fit in your life. People ask me all the time, what's the best diet out there? And I'll say the one you stick to. That is the best diet out there. Because it's got to be a lifestyle. A diet is temporary, a lifestyle is forever. And so there's different tools in the toolbox. So there's commercial programs, there's medically supervised weight loss programs, and as well as if somebody qualifies, they may be surgical interventions. So the toolbox includes nutrition, sleep, exercise, stress reduction. Those are the mainstay. For some people, we do use weight loss medications, but that depends on the person, their medical conditions. Not everyone qualifies. For surgery, it depends also. Not everybody qualifies for surgery. Typically, the cutoff is a BMI of 35 with some health conditions involved. Or if their BMI is 40 and above, they do qualify for bariatric surgery. So we would love to help you here at UCLA, and if you're interested for more information about these clinics, we can help you. We have 3 different clinics: the Clinical Nutrition Clinic, the UCLA Center of Obesity and Metabolic Health, also known as COMET, as well as UCLA Weight Management Program, also known as RFO. So the Clinical Nutrition Clinic is we use education of nutrition to improve medical conditions. The clinic is run by physician nutrition specialists that focus on using nutrition to try to help you improve your chronic diseases. So fatty liver, diabetes, high cholesterol, polycystic ovarian syndrome, cardiovascular diseases, hypertension, as well as weight loss. COMET is a multidisciplinary team. It involves bariatric surgeons, so Dr. Dutson and Dr. Eugene Chen, both of our bariatric surgeons, as well as bariatricians and gastroenterologist Dr. Simon Bevan, as well as Rabinder Watson. So we focus on helping patients who are interested in bariatric surgery or they want to have medical weight loss options. We do have medical weight loss consultations, and we also help with people who've previously had bariatric surgery and they're starting to regain weight. We're a multidisciplinary team, including with dietitians and psychologists involved. UCLA Healthy Weight Management Program, also known as RFO, is our most intensive program that is available at UCLA. It is a weekly session. It's multidisciplinary, also involving physicians, dietitians, and psychologists. The basis of this program is a little bit different. We rely heavily on body compositions as opposed to BMIs. We believe that BMI cannot capture the entire picture, whether someone's truly overweight or they have a lot of muscle mass and they're weighing more. So we use body compositions to help us determine the best meal plan for you. This is a personalized meal plan approach, depending how much weight people need to use, what their lifestyle is, and so we design meal plans that way. So in summary, modest weight loss of 5 to 10% of your total weight has health benefits. Losing 10 pounds reduces 40 pounds off your knees. Not every calorie is the same. Reducing processed carbohydrates can help lower your cholesterol, improve blood glucose control, and help you lose weight. Protein can help you suppress your appetite and maintain your lean body mass. And the best diet out there is the one that you stick to. So we would love to help you here at UCLA. This is our contact information, our telephone number, and our website. So we'd love to meet you. So thank you for joining us today. If you have any questions, you can put them on Twitter using the hashtag UCLAMDChat or comment on Facebook. And I think right now we have some questions. So who qualifies for weight loss medications? So it depends on the person. So anyone who has a BMI greater than 30 does qualify for a weight loss medication depending on their medical history. A lot of the medications do have restrictions on who can use them, especially if a history of heart disease, stroke, glaucoma. These are things that we take into consideration. Also, if someone has a BMI of 27 and above but has some comorbidities including prediabetes or sleep apnea or something, we may consider using a weight loss medication at that time. Are daily multivitamins, here's another question, I love this question. Are dietary multivitamins, fish oil, supplements useful if I don't have time to cook healthy? So nothing replaces cooking healthy or having a very balanced diet, because we don't understand the way food is processed. In the sense, packaged. There's a lot of fiber, there's a lot of nutrition, there's a lot of vitamins packaged, and so the absorption of how the body takes it in is unknown. So it's actually best to get it through diet, but if you're unable to consistently get it through diet, it's okay to take a multivitamin and a fish oil. Okay, there's another question here. So when should I choose bariatric surgery versus weight management / nutrition? So that's a personal sort of decision. It's a good question to ask because it's a discussion to be had with your primary care provider. Not everybody does well one way or the other. So you have to know your body, you have to know what you're able to commit to. And so it also depends on how much weight you have to lose. So those can all determine which is the best option for you. And how to think about the risks and benefits. So there's actually, if you're interested a little bit more on bariatric surgery, there's a great video on the COMET website that kind of goes through all the risks and benefits. There's an informational session that's held about bariatric surgery that has a calendar of events on the COMET webpage. So it actually is outlined right there for you. So I think that would be what we have today. Thank you so much for joining us today.